Hi, my name is Nur Alia Natasha. I'm going to answer my practical test on how to educate a patient to perform abdominal hollowing. So this case study, a 45-year-old housewife complained a right side of low back pain due to L4-L5 lumbar stenosis and radiating pain to the right side of the lateral calf muscles after a prolonged standing. So this patient will perform exercise from a lumbar segmental stability exercise. So the main components that are very important in this technique for the lumbar stenosis patient is that it's going to retrain the neuromuscular control and stability not only on the lower back region but for the whole spine. So the components in this lumbar segmental stability exercise is that it's going to include the control of posture, rhythmic stabilization exercise, contraction of the transversus abdominis, and concurrently with the activities of the multifidi muscles as well. Because usually in cases of low back pain, or in this case which is the lumbar stenosis patient, the transversus abdominis muscles of the patient will or may become deactivated and lead to loss of control of the core muscles activity, and then these core muscle activities are unstable because they are trying to regain some control. So the main goal of this lumbar segmental stabilization technique is to basically retrain the transversus abdominis muscles to keep contracting at all times except for in supine lying position. And it is very important for the patient to perform this exercise correctly in order for the patient to really feel and to properly contract the correct muscles, which is the transversus abdominis muscles, and also to avoid any recurrent symptoms or further worsen reproducing of the back pain symptoms, or which is also radiating pain in the case due to improper technique or improper posture during performing the exercise. So next I'm going to demonstrate on the correct way to do the abdominal hollowing exercise as part of the lumbar segmental stability. So the first one, we begin with the in sitting position. So the position of the patient, she should be sitting in an erect posture with the neutral spine, without any stoop posture, with a forward head posture, and without any hyperextended of the spine. So it should be in an erect neutral spine position with 90-degree flex on the hip joint and the knee joint as well. The hand can be resting on the thigh muscles. Alright, so the cue for the patient is that the patient should do the abdominal hollowing by tucking in or moving in the belly up to the navel without moving the rib cage or without moving any other accessories muscles such as the shoulder. So usually the patient will perform incorrect exercise of abdominal hollowing, such as, so it involves accessory movement, but the correct way is that it should be only contracting these muscles at the abdominals or the transversus abdominis without any other extra muscles are moving. So back in the sitting position, hands resting on the thigh, so they just should feel the movement or the contraction of the muscles moving the belly in up to the navel. So if the patient is unsure whether she is contracting the correct muscles or not, I will ask the patient to put her fingers, find the bony part of the pelvic or the anterior superior iliac spine. So find the bony part there, and then just above and in on the muscle tissue area. not exactly on the bony part. So when doing the abdominal hollowing, the patient should feel the contraction. So if she feels the contraction, meaning that she's doing it correctly, but if there's no contraction, she's doing it incorrectly. Alright, so while doing the abdominal hollowing, the patient, the contraction of the muscles should be begin with 8 seconds. So find the muscles and then sit in an erect posture, neutral spine, and hollow in the belly. So contract 1, 2, 3, 4, 5, 6, 7, 8, and relax. Alright, so the patient should do this exercise for 8 seconds without any accessory movement of the rib cage and the shoulder, and also without holding her breath. So she should normally breathe in through the nose and breathe out through the mouth. So breathe in 1, 2, 3, 4, 5, 6, 7, 8, and relax. So the resting duration should be around 5 to 10 seconds before going for the next repetition, and this exercise should be can be repeated for 10 repetitions, and then gradually progress by either increasing the duration of the contraction or increasing the repetitions. Okay, next is I'm going to demonstrate on how to do the abdominal hollowing exercise in standing position. So the same technique applies for the exercise apply for in standing position, which is to move the belly in up to the navel without any movement of the rib cage, without holding the breath. And the position of the patient should be in an erect posture without any hyperextended or stoop with forward head posture. So it should be straight, and a therapist can also assess the correct position of the patient from the side view by looking at the plumb line, which is the ear level should be level with the shoulder or the head of the humerus. So that is the erect upright position, upright posture that should be performed by the patient. So again, if the patient is unsure, just ask the patient to self-palpate the transversus abdominis, and then abdominal hollow 1, 2, 3, 4, 5, 6, 7, 8. She should feel the contraction there and then rest. Alright, and do not hold the breath. Okay, so that is in standing position. We can progress the exercise by increase the duration or increase the repetition, and we can also progress the exercise using movement for the upper limb. So meaning this involves a more rhythmic functional movement during doing the exercise. So without any equipment or without any weight bearing stuff, so we can ask the patient to perform the upper limb movement to slowly flex the shoulder up to 90 degrees to begin with, while performing the abdominal hollowing. Alright, so for example, so abdominal hollowing, and go, and raise up your hand forward, hold it 1, 2, 3, 4, 5, 6, 7, 8, and slowly put down. Okay, and the patient should not immediately put down the hand, because that shows that there is no control of the muscles of the transversus abdominis. Alright, so the contraction should begin right at the moment when the hand is lifted up, and then it should keep contracting until the hands are at the starting position, and then only the patient can relax. Alright, so repeat the movement. It can be from the forward flex position or the full shoulder flex up and go down, and it can also progress with the abduction 90 degree while doing the hollowing and up. Alright, so that's for the upper limb movement. And other than that, lastly, we can also add some activities or using some toys or equipment to help coordinate the upper limb movement to be in a correct coordination while doing the holding in. So using for example like a ball, so while doing the holding in, the same thing, hold in, contract and hold the ball either 90-degree, hold it 5, 6, 7 without holding breath, and slowly put down. Same thing, we can do the holding in, up, contract, go up, and then hold it 1, 2, 3, 4, 5, 6, 7, 8, and slowly. So the main goal of doing this exercise is to retrain the muscles of retractors abdominis to keep contracting at all times, because especially when doing in a standing position, it can also affect the multifidi muscles, which is the whole back area, and then it can retrain the muscles to it can help. This exercise can help to reduce the pain intensity while doing functional activities as well. Okay, sorry. Alright, continue. So lastly is the the lower limb movement while doing abdominal holding, is that by flexing up the hip up to 90-degree while holding the belly. Right, so same thing, hollow in and flex up the hip. So the position that should be observed in the patient is that it should be in erect, and then while doing the hip flexion, it shouldn't be moving to one side where the pelvic is increasingly higher than the other. So while doing the hip flexion, there shouldn't be any movement of the spine. Alright, and do not hold the breath. So the instruction will be, now tuck in your belly for 8 seconds and hold it while moving down. So tuck in, contract, 1, 2, 3, 4, 5, 6, 7, 8, and still contracting, going down, then only relax, and then break duration for about 5 seconds. Continue with the right side, tuck in and flex up, bring up your hip, 3, 4, 5, 6, 7, 8, still contracting and going down. Now repeat the repetition for about 10 repetitions, and to progress you can increase the duration of the contraction or increase the repetitions. Alright, I think that's all from me. Thank you.